So many germinal center lymphomas, both follicular lymphoma and diffuse large B-cell lymphoma, have many epigenetic mutations and drivers of disease. And this has been recognized for quite some time, and here at the Lugano meeting there's been some nice presentations really discussing the impact of multiple epigenetic mutations, and that it's really challenging to just target one as a strategy for treatment for aggressive lymphomas. So with this in mind, in the laboratory we evaluated combining EZH2 inhibition with HDAC inhibition. Both EZH2 and histone acetyltransferases are mutated in diffuse large B-cell lymphoma and follicular lymphoma, both in about 40% of the time. So EZH2 mutations lead to gain of function of this enzyme and leads to transcriptional repression in the germinal center. Histone acetyltransferases have inactivating mutations, and this leads to decrease acetylation and also to transcriptional repression. So the idea is, could we target both of these pathways to kind of try to sort of double down on this biology that's driving some of these lymphomas. And we found really nice data in the laboratory, both in preclinical models and cell lines and in mice, showing that targeting EZH2 and HDAC inhibitors leads to synergistic interaction. So with this in mind, we developed a phase 1 expansion clinical study of Belinostat, which is an HDAC inhibitor, plus Tazemetostat, which is an EZH2 inhibitor. The phase 1 study will take any relapsed refractory non-Hodgkin lymphoma patients, and the expansion cohort will allow for germinal center diffuse large B-cell lymphoma, relapsed refractory. And our hope is to really do extensive correlative studies in this clinical study. So it's really kind of a pilot to understand biology. We'll be collecting paired tumor samples to look at changes in gene expression profiling. We'll be looking at changes in histone acetylation and methylation through mass spectrometry. We'll be looking at baseline histone acetyltransferase mutations such as P300 and CREB-BP, as well as EZH2 mutations to see if any of those mutations correlate with response to treatment. And lastly, we'll be collecting serial peripheral blood to look at how these drugs also might modulate the immune system. We know that both of these mutations can lead to immune evasion in these diseases, which make them more resistant to immunotherapy. So this is a nice way that we can look as before and after treatment to see if we're able to modulate the immune system, upregulate MHC, which is often downregulated in these diseases, and perhaps use that as some background information for further treatment, perhaps in combination with immunotherapies in this setting. So we're really excited about this study. This trial is open through the CTEP ETCTN network throughout the United States, and we have a number of sites that are already collaborating, and we're in the middle of enrolling the first dose level. So we're excited to see how this goes, and especially for the correlative studies that are involved.